So I want to jump into a few questions that we commonly see coming up either in our Facebook group, our support groups, or just sort of across the board with parents. We know that there was a bit of a terminology shift from non-alcoholic fatty liver disease recently to MASLD, and parents are starting to hear this shift in terminology, as well as clinicians. We have a lot in our primary care setting that aren't familiar with the new nomenclature that's arising. So how should clinicians specifically or parents advocate for their primary care doctors to adjust their diagnostic approach in the pediatric setting?
Thanks, Margaret. That's actually a great question. So before I even go into like all the nuts and bolts to that, I actually wanted to start with what is pediatric MASLD? So it's going to be a mouthful. So pediatric metabolic dysfunction associated steatotic liver disease. Pediatric MASLD. Before, it used to be known as non-alcoholic fatty liver disease, and also it's termed fatty liver. In 2023, this was really changed because of the stigmata surrounding the terminology of alcoholic as well as fat. But when we go down to it, it's basically the accumulation of fat in the liver. And when there's further liver injury, this can lead to inflammation or can lead to scarring in the liver, which is basically known as liver fibrosis. And then eventually, if it's not stopped, further advanced fibrosis or scarring in the liver that's irreversible is known as liver cirrhosis. So it's really truly a spectrum. And I think that, now we're going through the process. It's very difficult for many families as well as providers because there has been a big shift. People are like, what's MASLD? Oh, is it NAFLD? Is this fatty liver? Is this something new? But I think how we could advocate for it is to encourage our families to ask what's the difference. And I think the main difference that we've seen in the diagnosis itself is one, you have to have a cardiometabolic risk factor. So what is that? That's the fancy term of saying you have a cardiovascular risk for diabetes, like high blood pressure, high cholesterol, that associated with the fat in the liver that's seen on imaging. So now it requires a diagnosis of fat or hepatic steatosis is the medical terminology. And usually this is done by ultrasound, gives you that pediatric MASLD diagnosis. And so, in the pediatrician's office or family physician or your primary care, providers, generally we do screening for liver enzymes when there is a high risk. Meaning, what does that mean? So that means that you have a diagnosis of being overweight based on CDC growth charts with risk factors. You have a family history of, MASLD. You have a diagnosis of obesity. So those high-risk patients actually get screened by liver enzymes. And that's still part of the workup in pediatrics, irregardless of the new diagnosis. So I think this is a continuum of really saying, you have MASLD, but NAFLD and fatty liver are the terminologies known, and you're just going to have to link both and explain the whole thing together.
Yeah, I appreciate that great explanation that sort of highlights the differences, but also how they're still a little bit similar in terms of the understanding of where we have come to where we are moving to. Thinking back to those physician appointments, or maybe they are starting that screening process and say that they come back and the liver enzymes are elevated. What are sort of the next steps for a parent to take if there's pushback from their provider, maybe saying, hey, this is normal, these are still really low numbers? How can a parent better advocate for their child in those times when maybe we're still under the understanding that this isn't a big deal disease?
Yeah, that's a really good question. I think the first thing is really asking why the pediatrician might think that it might not be concerning. There are a lot of reasons why liver enzymes can be elevated, and sometimes they can be elevated because of a cold, they can be elevated because of another infection or another condition. But if it's chronically high, and if there are those risk factors that Jen was talking about, then that definitely should pique their interest a little bit and consider, should we get that ultrasound? And knowing that the diagnosis needs imaging, evidence of that fat in the liver, having parents advocate for looking into that would be a good next step. And then also just advocating for further education for pediatricians to know to look out for this and then know when to then connect with a GI or MASLD physician.
Right. So I think this is a really important topic because one of the issues that we're having is actually screening from pediatricians and primary care providers in terms of, and overall the screening practices range from 10 to 30%. And overall pediatricians have a large amount of patients they're seeing and the screening guidelines are not standardized across. And I think that's one of the issues that we have to educate our families as well as our primary care providers on addressing. And once we do that, I think it'll be better in trying to identify the patients who truly have MASLD.
Yeah, and at that point, we're happy to get referrals. And the next step is really to make sure that there are no other chronic liver conditions that might be contributing to either elevated liver enzymes or even fat deposition in the liver. So that's kind of the transition role of towards us.
So, talking about getting to you all, if they do have a clinic that is local to them, or maybe they are fortunate enough to have Children's of Philadelphia right in their backyard, how does a parent go from the primary care setting to you guys? Is that kind of the first step, or does imaging need to happen first before they get to you? What does that transition look like from primary care to you guys' specialty clinic?
Yeah, we see a little bit of both. Jen, you can talk about this as well, but we see a little bit of both. Sometimes pediatricians have already been proactive in ordering an ultrasound, and sometimes that's not available or it takes some time. So it also depends on the referral time. So sometimes it takes, a little bit of waiting, or we can get people in on the quicker end. So if there is some time between getting the liver enzymes done and they're high and an appointment time, then doing that ultrasound in between can be really helpful. But the process next step is really for the pediatricians to place that referral, and then that'll come into us.
We want to empower pediatricians to be able to, work up the patient in the beginning. So generally what we say is that if they've identified these patients have elevated liver enzymes, to give general counseling first. So what does that mean? Like really put in, like talk about nutrition, talk about exercise, talk about sleep, talk about high risk behaviors, and then repeat the liver enzymes again in 3 months. And if they're still elevated, then they can refer to us unless there are advanced liver disease signs, right? So they have symptoms that are pointing to more jaundice, which is yellowing of the eyes or skin. They have concerns about abnormal bleeding, chronic fatigue, other advanced liver clinical symptoms that would push to see us earlier. Also, if their ALT is greater than 80, which can indicate more advanced liver disease, then we generally say for them to refer faster. But in the beginning, it really, the primary care provider is their source of contact, source of trust. And so I think having them follow up with them just to establish what needs to be done, then we can see them. But honestly, we see all patients at all times. So we're always welcome to have the referrals. But I think it's also hard on some, depending where you live, right? Some places only have one pediatric gastroenterologist or one dietitian or one exercise physician. But I think in other places like at CHOP, we are well resourced and we are happy to see them as soon as possible. And if a pediatrician reaches out to us, we're happy to get them in as soon as we can.
You mentioned something that I want to kind of go back to. You spoke a little bit about how they are the frontline providers in those primary care settings and how they might encourage those changes in nutrition or behavior changes overall to maybe the child's activity, et cetera. But I'm curious, how can healthcare teams better engage families to help promote those changes when there are so many barriers that can kind of come into play in terms of either the family lifestyle or maybe they're on the go a lot and needs more support? So what are ways that primary care settings can sort of empower the patients to really engage with them and not just say, here's your letter on the way out the door, make sure you make these changes. Where can that engagement really come into play?
Mm-hmm. Yeah, I think having the pediatricians and primary care providers also engage the family is really important, because this is kind of a team effort, and that really helps encourage and motivate kids as well. So when it's a household family activity and you're all coming together and cooking more or going on walks together, I think making kids feel like this is not they're not on their own. And I think that's something that pediatricians can help encourage, because they do develop these longitudinal relationships with the families and the kids too. So I think that that's a first step. And I think also having a few tools in their pocket, so a few key nutritional and physical activity advice, I think that will be helpful. Not every pediatrician is going to be an expert on nutrition or activity, but having a few of those recommendations to give to these families would be important.
Seen it, done different ways, but I've always told people I'm teaching, whether like fellows, colleagues, the most important thing for my patients to really progress in treatment of their own liver is empowering them. So how do we empower them? One is we educate them to really understand what is this disease, right? Because most of the patients will have no symptoms. They're asymptomatic. They're diagnosed by these screening liver enzymes, and then they're told they have liver disease, and it's like a big shocker to everybody. And they're like, "What does this mean?" The parents are generally very worried, but the kids are like, "Why am I here?" And so I think starting there, like what we try to do is show them a picture of what it means to have fat in the liver, but also tell them that they're able to treat their own liver. So what does that mean? A lot of this fat that's there, or even if there's inflammation, or even now if there's like, scarring, which is the fibrosis, is reversible if they're willing to put in the work. And so what does the work mean? So that means starting with lifestyle intervention is still the cornerstone of our therapy, but doing like what Andrea said was a family-based approach. We know that you can't do it alone. So trying to, get the buy-in from the patient as well as the parents is always my first step. Boy, what do you understand about your disease? How can we help you treat your own liver? What are the things that you need to be successful? And so I try to identify that earlier on, whether it's, screening for food insecurity, whether it's trying to assess what are the resources available to the family, whether it's trying to give those resources. Not every hospital has a dietitian, or a pediatrician's office has a dietitian, or do they have an exercise specialist? But I think this is where, even being in Philly at CHOP, I'm hoping to help people who are over in Texas or in California so that we can give them the resources that they can use in their own pediatrician's office, right? And then what Andrea did say is starting simple. Like I always go, what are the drinks that you're drinking? And I know that sounds simple, but truly fructose is one of the biggest culprits of accumulation of fat in the liver. So we really go into the nitty gritty and I really say, are you drinking soda? Are you drinking sugary beverages, but not just limited to soda? Are you drinking anything that has added sugar? Are you drinking like juice? What kind of juice are you drinking? Are you drinking lemonade? Are you drinking tea? Is this sweet tea? Like we're going into what kind of milk are you doing? Are you doing white milk? Or are you doing chocolate milk? So I know that sounds very simple, but really starting with one simple goal in terms of nutrition and one exercise goal, as understanding what is their baseline, activity. If we're going from nothing, we're not going to go to the AAP recommendations of, exercise for 60 minutes most days of the week. We are going to go into, well, maybe we start walking, but what days are we going to walk? Are we going to walk on like 3 times a week? But no, let's go more specific. You're going to go into, we're walking Monday, Wednesday, Friday. We're walking for 10 minutes. We're walking after school. This is going to happen before we sit down on the couch. So empowering them with 2 focused goals that they have chosen also for themselves, and then keeping them to to make a contract in a sense to say you're going to stick to these goals. And then when my patients actually are able to come back after a month and they've done these 2 small goals, I know they sound simple, but they're very difficult. Then they feel more empowered because they're now like, oh, I've achieved this. I can do this. And then you add more goals on. So I think really going back to how do we educate our patients? How do we empower them? How do we ensure that they sustain the change? And then how do we move forward? And they can't do this alone. So you also have to get the buy-in from their family, right?
And also make it fun. So sometimes finding what sports that they've never tried, but they've always wanted to try, and trying to encourage that. And you can find fun ways to, like I was saying, cooking days with the family, fun ways to make nutrition fun too.
I
guess the other thing, sorry, Morgan, I was going to say the last thing, obviously I'm so passionate about this, is also talking to the patient about why do they want to do this? What motivates them to make the change? Because we all have different reasons, right? Our parents generally want us to be healthy and want us to heal our liver. But most of the time when you don't have symptoms and you're like, why am I going to choose an apple over pizza? Tell me. You got to figure out what really truly motivates them. And some patients will say, yeah, I want to be healthy. But some patients will say, I just want to breathe better. I want to be able to do basketball. I want to be able, so let's make that your goal, why we're making these changes. So they really have to understand why they're willing to put in the work, right?
Yeah, and also finding that balance between giving these lifestyle modification guidance and not feeling like we're judging them or we're looking for a number on the scale, and not making people feel self-conscious, especially, keeping a positive view on these lifestyle modifications. And really, we're trying to help the liver get healthier above all else.
I love that concept of allowing the child to sort of steer the ship, right? Not giving the parents all of the power in terms of, what does tomorrow look like? What do your goals look like? But really encouraging the patients themselves, regardless of their age, to sort of say, these are the things that I feel are attainable. Let's set realistic goals, and sort of using that motivation to continue to empower them and encourage them to move forward. You mentioned something that I want to circle back to, that oftentimes there's no symptoms associated with this. And we know that we can also see MASLD in children who maybe are not obese and are not overweight. So in terms of those children, I feel like is that more difficult for acceptance for the parents or for the children themselves when they're saying, hey, I don't fall into the standardization of what might clinically appeal to be MASLD, but maybe they have, family history of it, or they have some other sort of metabolic dysfunction that has led them to this point, but they don't see the physical changes that they're making, right? They're not seeing weight loss. They're not seeing these physical changes. So how do you keep them engaged? How do you keep them encouraged?
Take this one. So I think it's a little bit different. It depends what's the mechanism behind or how like the fat had accumulated in the liver. So it's a little complex if it's genetic based. So we do have patients, and I'm going to go a little more medical, so who have example a PNLPL3 gene, right? That causes them to accumulate fat. It has a higher risk, especially in our Hispanic population, of accumulating fat in the liver. So what I tell my families is that when you have this higher risk, we are still going to like comb through your diet, even though you don't have obesity, even though maybe you don't have diabetes. But what we focus on is like, what is the nutritional content of your diet? You may be of a normal weight, but your overall intake is not a great, well-balanced diet. It might be high in carbohydrates, but you're able to have a normal weight. You may be, I always joke, my husband is quite skinny, but he eats horribly, right? So we had to change his diet. So I think it's looking into those components and really saying, again, we're not here to look at the number in the scale. We're not here to focus on what is like overall your just BMI and like it just in regards to obesity. It's really trying to ensure that you're living a healthy lifestyle and making sure that counters into having a healthy liver. So looking at the components of your diet, looking into the components of what you're doing at a baseline for exercise still helps the liver irregardless of what the weight is. So just to clarify, so what does that mean? We know that when we do aerobic exercise, this oxygenates the liver to help mobilize fat. We know when we change the contents of what we're eating, specifically if we focus on higher fiber, we decrease our carbohydrates, we decreases our sugar, that decreases what we say is our free fatty acid delivery to the liver, so it doesn't accumulate the fat in the liver, or helps with expulsion of the fat in the liver. So even though it sounds like these are just healthy lifestyle interventions that we're doing for a patient who may have the diagnosis of obesity, it's not that simple. It actually, all these lifestyle changes are impactful in the liver, irregardless of what's happening to the weight. So I think that's one angle to look at. And then the second angle is, if there is a reason why you have a genetic predisposition, then we're really going to have to address that. So so this is why I do what I do, because a lot of Asians actually have a normal BMI, but they have what is called as lean MASH. So addressing those things and looking at what's happening to the liver in terms of obtaining repeat liver enzymes, seeing if there's improvement based on that, or seeing what's happening to the imaging, or if they did get biopsy, what's happening to, if they get rebiopsied, how are the changes improving over time? So I think looking at parameters, not just by the scale, but also by looking at what's happening to the lab values and what's happening to the fat and the scarring on like imaging techniques.
Yeah, and some of these patients can actually have more severe disease. So we definitely don't want to scare kids, but sometimes in the older kids, they actually like learning more about, the natural history of what happens to the liver if nothing changes, and just presenting the facts of, the potential consequences of if we don't do anything, if it's not left treated. And that sometimes can also make them realize, okay, so this is actually, something that could have really long-term effects on my life. How can I help with making those changes?
Well, I really appreciate you guys being here with us today. I want to wrap up on kind of a piece of advice. So if there was one piece of advice that you could give to a new patient or family that is coming in, maybe still a little bit scared, maybe a little bit still in denial about where they're at with their new diagnosis, What would that piece of advice be?
I'll start off with saying, I usually say little changes can go a really long way with your liver, and your liver can actually, it's so dynamic. It can heal itself really well. So that's such a positive encouragement. And I would say, really making those step well changes. I don't want you to make a drastic change, but little things that are sustainable, and then you'll be able to see the difference over time usually.
I mean, I agree with Andrea. She always hears me say this to all of my patients. I always tell them first, it's a marathon, it's not a sprint. I'm not here for rapid weight loss. I'm here to help empower you make changes for a whole lifetime. So, I know that you can do this. I know we can make great changes together. We're here to help you with whatever you need. And most of all, I tell them you can heal your own liver. So that's powerful. So yeah.
Well, I love those two pieces of advice to give to parents, offering that encouragement as well as to the patients, saying that, again, you are in charge. This is your journey. This is where you get to start and finish. So thank you again, both of you, for being here with us today and answering some of these incredible questions that we have had coming in. I appreciate you both.
Thanks for having us.